We'll get started with the presentation right now, and I promise to keep this short, try to get you guys out of here pretty quickly as well. So ladies and gentlemen, IntraCare started our journey about 9 years ago, and we consider ourselves truly blessed to be able to work alongside so many capable doctors, such as yourself, whose hard work and collaboration has actually helped us generate over $300 million in shared savings just in our Medicare MSSP program, which is our value-based care program. And I'm choosing the word collaboration intentionally here because we do have a 50-50 split with our physicians when it comes to the distribution of those dollars. Most recently, I would just like to point out that our ACO has been ranked the #1 ACO by Texas Medical Association in 2021. And I say that mainly as an acknowledgement of their hard work, their staff, and the internal team, because it takes a village to build something truly amazing. And I believe that we here at IntraCare we value your care, your lifestyle, and the care of your patient as well. So moving forward, as you may already know, the current climate of our healthcare industry is increasingly headed more and more towards more of an outcome-based medicine approach compared to your traditional fee-for-service model, and it is becoming increasingly more challenging to stay competitive in this market while feeding your entrepreneurial spirits, while providing the highest level of care possible for your patients, and I'm sure 1,000 other things that get asked from you on a daily basis. So when we talk about understanding those challenges, we at IntraCare genuinely understand how to provide value-based care, how to provide the trifecta of value-based care of providing better health, better patient experience, and reducing your medical costs while leading with your payments and the sustainability of your practice in mind. One of my mentors has actually taught me that whenever you're trying to explain something as complex as our healthcare industry, it is always good to start with the universe and then break your way down and connect it back to you, what it means for you. So right now, let me actually set up an interesting topic about what is going on in our healthcare climate. The current healthcare industry accounts for about $4.3 trillion of our GDP, and it's actually growing. There are currently, on a daily basis, 11,000 citizens that turn 65 on a daily basis, and each costing the healthcare system, on average, about $12,000 per day, which if you multiply that, comes out to be an average spend of about $132 million per day that we are adding to our GDP. So folks, in 2011, Medicare hardwired value-based care models, starting with the ACO models, to drive savings, optimize utilization, and enhance predictability. Why is this? Medicare has announced that it is following through with aggressive adaptation measures to expedite 100% of the spend to be linked to value-based care by 2025. And why that is because we are trying to shift our mindset, our care, from a fee-for-service perspective onto a value-based care, an outcome-based perspective. Those same value-based care measures that you're currently doing for your Medicare panel has actually been extended to your Medicare Advantage companies as well, with incentives to grow, which is why now you are probably seeing a high interest for your practices to be acquired. So let's start digging into why there is that high interest, your true value, and the gold mine that you guys are actually sitting on. This is a very simple slide showcasing. So over here, folks, this is a very simple slide showcasing what the whole complex healthcare business model that I'm going to break it apart for you in one slide and what is happening over here. So we are seeing today in Medicare and Medicare Advantage and why people are wanting to acquire practices. It is actually based on this logic. On the left, on the very left over there, the person that you see is actually your traditional fee-for-service model. These are the people who see patients, bill the patients, keep some for the overhead, and then you get to take some home. On the other side, what's happening though is about, if you look at your track record, over the last 10 years, about 32% of your fee-for-service income has actually gone down. So today, all the contracts you are with, on the right side now, may or may not disclose this to you, but behind the scenes, this is what's actually happening. For example, let's take Optum, for example, aka United, gets a premium. If you look on the right side at the bottom, this is a premium of $16,000 to manage 20,000 patients. Medicare is paying them $16,000 per patient, and if they are managing 20,000 patients, that means their portfolio comes out to be at around $820 billion to manage. These large insurance companies run a rate of about 25%, 20% savings rate, which comes out to be an $80 million of surplus. So we took it from the universe, we took it to the insurance companies, now that we bring it to what it means for you. These Medicare Advantage plans are coming to you and saying, doctor, this is the United panel, this is your panel, and we need you to complete your FOCs, we need you to complete your quality measures, whatever. And from that, they are giving you a portion of those monies. And that portion is currently adding up to be about 2% or I would say 3%. The highest one I've seen so far is 4% that's coming to you. Normally over here, I had paused for a lot of questions because I was given a lot of information. But I'll keep going for now. And I highly encourage that you come meet with me after if you have any questions. So the $80 million is now around everyone in the country is chasing. This surplus is where the large insurance companies, they are basing their business models on. If you look at the publicly available data, the financials for example, Optum, when I looked at it, I saw 75% of their revenue, their quarterly revenue, which is publicly stated, comes from Medicare Advantage. Medicare Advantage side of their business, which is the senior population. If you look at Humana recently announced about a month or 2 months ago that they are pushing their commercial contracts away and focusing strictly on Medicare, on senior lives moving forward. If you look at the trends, same things going on with Aetna, Cigna, Blue Cross Blue Shield, all. So now what's happening is all of these platform companies, such as you may have heard of the names Cano Health, of course you know Optum, where they see a big surplus, they're seeing this big surplus coming back for the job that the physicians that they are, well, they put them under an employee model, where for you are the ones doing the work and the surplus is going to them. Okay, so $80 million, that's a surplus. That is what everybody is chasing around the world, around the country. And what it did was, it actually has created a market for what the gold mine that I was talking about when you are sitting on. So if I go to the next slide, I would actually like to show you some of the transactions. If you look at the bottom right of your screen, I'll enhance this a little bit further, which is, let's start with United. This is United Optum. This is their footprint across the country. There is high motivation here, high dollar value here, high opportunity So let me go back to talking about the market, that the market has been created over here. If you look at the transactions, I will actually meet with you if you'd like and walk you through each of these transactions. I'm showing the name of the company, such as SoftBank, your Walgreens, your Amazon, purchasing One Medical. All of these transactions are taking place all because of that premium that we are talking about. There is an interest out there for the premiums that are being paid. There is an of acquiring large entity groups. Unfortunately, that same interest is not there for a single physician practice or a group of physician practice, but a large organized group where you can be a part of. It helps you be a part of this transaction instead of just the day-to-day, just the FOC transaction. The 2 to 3%. Now we are connecting it back to what's really going on with that. And I'm not sure if this is being disclosed to you or not, so, and if you'd like to discuss this further, I'll be more than happy to walk you through each one of them and show you for this transaction, this was the company, this was the company they acquired, which number of lives they had, the dollar amount, whether it was an EBIT transaction or a revenue transaction. Like I said, I'm not a doctor, I'm a business person. So my goal in life is to basically provide support from a business perspective wherever I can. And this is the last page. This is actually the most recent 2022 transactions that have been taking place. I know it's hard to read, so like I said, I'll be more than happy to walk you through and sit down with you individually. If we look at the trend over here in the market that I'm talking about, the orange line is actually the acquisition of primary care physicians compared to the hospital acquisition. If you look at the trend, just in the last 3 years, it's gone up more than 10 to 15%, while the hospital trends have actually stayed pretty much the same. So, on the left side, what you're seeing over there are actually our competitors. What's their current process? When they look at your financial, when they look at your EBITDA, which is your earnings before interest and taxes, and they'll give you an offer maybe 3 times of that. If we have 100K left at the bottom, they'll give you maybe between 300K to, let's say, 1.2 million. Then you pay your capital gains tax on it. Then you become an employee, and now you've lost your ownership, you have lost your governance. And, you guys are all here with your entrepreneurial spirit. So you're giving up something. And what you're giving up is also your exit participation. That surplus that I was talking about is directly connected here. If you are in this transaction, you do not get to be a part of that larger amount. It's still that smaller amount. So the difference with partnering with IntraCare is that we understand without you, without your partnership, without your knowledge, without your understanding, leading it and guiding us in IntraCare, I do know one thing that we believe in is keeping you as a partner. So we're not talking about bringing you on as maybe an employee position. Our goal is to partner with you to take an opportunity, take this opportunity and make it profitable, to provide value-based care and put the dollars, that high dollars that I was speaking about, into your pockets. Because let's be honest, am I doing all the work? Am I the one seeing the patient? Am I the one sitting up late at night doing the documentation, giving up family time? No, I'm not. It's you. It's you who are doing the bulk of the work, and at IntraCare we believe that we need to provide value-based care, and we need to ensure that the doctors are included in the financial aspect of this as a partner, 50-50 with us. Ladies and gentlemen, my name is Kaiser Sayani, and once again I encourage each one of you, if you'd like to come meet with me individually, and what I will do for you, I will actually walk you through this again. on a one-on-one basis, and I will create a customized model for you. What does it mean for you, your practice, and your lifestyle? So at the end, I would just like to say, well, I'm here for you, and I thank you so much for your time.
Thank you. Thank you, Trevor. Thank you. Any questions or? I guess we are 1:04. So let's try to meet around 1:10 in the main hall. 1:10, another 5 minutes. Thank you.
The one thing that I'll say, if you guys do want to connect with us, we have Blake back there, we have a table back there. If you just drop your card or your email address, I will reach out to you personally, and we can connect. Thank you so much.